For falls or any incidents that they may have had, you can, if you're aware of any recent falls, you can document it here, or you can just check off refer to chart. Subjective, objective with swelling, ambulation, transfers, and the rest of it is pretty much all the same as on the initial assessment form, a little bit squished with less area to write because this is a reassessment. Is there anything else different? I guess for the objective part, for the Tinetti, the tug, the unipedal, and the 3-minute walk tests, there is a spot there where you can actually indicate is there an increase or decrease in their score since the last assessment, which may help you in your goal making, goal setting. Still have a room for your clinical impression or your analysis, room for resident goals, and the same boxes for agreed goals and treatment plan with the length of time in which you would like to achieve the goal, as well as the spots to fill in the blanks, and the treatment plan as well for 3 times a week, 5 times a week, or as specified below, and then your name and signature and date. So that's pretty much the same as the initial assessment form. And these are usually, it's the same, it's a double-sided form, but it's the same quarterly assessment on one side, and then 3 months later you can fill in your quarterly assessment on the other side. So you've actually got 6 months, 2 quarterly assessments on one sheet of paper, which helps to save space in the binders and the charts, because we all know how much paper we can get into the binders eventually. So I do encourage you to use both sides of the page. And that's our quarterly reassessment form. And so now let's take a look at the physiotherapy post-fall reassessment form. This is a one-sided form. This is what it looks like. And basically this was developed for nursing and retirement homes. We do get referrals sometimes to go and see residents after they've fallen, especially so in nursing homes. We may get lots of them. And at the top of the form we have the resident's name, room number, date of birth, the date of their fall, the date that you're reassessing them, if they had a head injury, what's the description of the event from the referral that you received, or your discussion with the nursing staff. Does the resident remember falling, yes or no, or they can't answer? What's their version of the fall? It's not always the same as what the staff tell you. Basically want to know, does the resident have any pain related to the fall? Yes, no, or unable to answer. Do their present cognitive impairments increase the risk of falls? Yes, no, or not applicable. And then, are there any significant changes in range of motion, strength, or balance since the previous quarterly reassessment? If you check yes, there is an asterisk there. You may be able to note it just here on the side. If you don't have enough room, at the bottom of the form it says please see other side for description of changes, so you can flip the form to the blank side and write more information about any range, strength, or balance changes since their last assessment if you don't have enough room here. Some of the things the homes wanted to know: are the wheelchair brakes working? Are the walker brakes working? If the brakes aren't working, did you fill in a repair request in the vendor's book? Are there any hazards in the room? And then, what are the instructions given to the resident in order to prevent further falls? You can indicate if the resident is unlikely to follow these instructions, because I know sometimes cognitively they can't. However, you may check off one of these choices, or you may write another one on the line. Also, instructions given to staff in order to prevent further falls. This may not be applicable if you didn't need to give any instructions to the staff or it was unrelated to a staffing issue. Otherwise, you can check those off or add an additional comment at the bottom. Indicate if there were any changes to the physiotherapy treatment plan. No changes were made or as indicated. And in some homes they are asking to document on the form what is the treatment plan for the resident. So you can say here to continue with balance training, walking program, whatever the treatment plan may be. The assessment was done by, you just indicate your name, and the date's already at the top of the form. So that's the physiotherapy post-fall assessment. Okay, so in retirement homes and community homes, we need to keep track of our reevaluations with residents. The college indicates that we have to see residents a minimum of every 3 months. In nursing homes, they're lucky. They have what's called RIMDS. Well, that's the unlucky part, but the lucky part of it is they've got their 3-month evaluations scheduled, so they They never miss reassessing a resident every 3 months because it's planned for them because of the nursing home set up with RIMDS. So in retirement homes and community setting homes, there is no such thing as RIMDS, which is a good thing because that's a lot of extra paperwork. However, that does mean that you have to keep track of your own reevaluations to make sure that you stay on schedule with seeing the residents every 3 months. So we have a resident reevaluation sheet, and this is what it looks like. And basically, it's just to help you track your evaluations. So if you look, you've got a spot to write the resident names here. What I would suggest is enter the names of the residents on your program. This is an Excel document. If you would like to have the Excel document, you can contact support office. They can send it to you. You can type in the residents' names, last name, comma, first name. That way you can sort them alphabetically. Makes it really easy to follow and keep track of. When you say, for example, you assess Mrs. Apple on January 1st, you're working New Year's Day, yes, you would write a 1 under January, and anybody else that you assess on January 1st, if it's Mrs. Banana and Mrs. Peach or whatever, you would write 111 under January for the date that you reassess them. Then when it comes to April, all you have to do is look back to who did you assess in January, and you'll know who you have to do in April, and the approximate date. So it makes it very easy to follow. I like to color code things too. So if I've seen a resident in January, I highlight the box that I have the date written in. So when I'm going to set up my times for April, I'll actually look, and I'll preferentially look for the boxes in January because I'll highlight them yellow, and then I'll highlight their boxes in April so that I know in April I have these people to see. In February I might highlight the people who I've seen with a blue highlighter so that in May I'm looking for everybody blue, and I'll just re-highlight the boxes in May blue for the people that I have to see. In March I might highlight them pink, and so then once I've seen them in March, I know I have to see them in June. I'll go highlight their box in June, so I can easily see who I have to reassess in which month. Sometimes it happens, let's say that I saw somebody January 1st, I've highlighted it, I'll go highlight April right away. In April, maybe I can't get to see them for whatever reason, they're sick, they're in hospital, who knows, sometimes these things happen. I'll write, I might write, if I went to assess them on April 1st and they weren't there, I'll write a small 1 with a dash, and I'll write S or H. I'll use the codes from the program log as to why I wasn't able to reassess the resident. And if I do get to see them, say on the 15th, I'll write 15, and then I'll check it off so that I know that I saw them on the 15th and that they refused or couldn't see me on the 1st. And I'll go re-highlight in July right away, knowing that they're due in July. It may happen that I know I'm going to be absent April 1st, so to not be late with my reassessment, I'll go see Mrs. Apple in March instead. Maybe I'll see her on March 24th. So I'll write 24. Now my new reassessment would be due in June instead because I saw her in March. So I saw her after 2 months here, so now I have to see her after 3 months, which would make it June. It's just a way to keep track. I find it works really well, and you can do the same sheet on both sides so that you have lots of room for resident names. And if you have any comments, this is just an open spot if there's something that you need to write, like maybe the resident moves out of that retirement home or that community home, or maybe they pass away. You can write here deceased or passed away or moved and the date so that you know that you don't have to see them anymore, for example. I usually write the year at the top of the sheet, so 2011, say, I would write at the top of the sheet, and I would have all my resident names, and as the year goes on, more people are going to come onto the program. I'll just add their names at the bottom, so that at the bottom they won't be in alphabetical order. When I prepare my sheet for the following year, I would change it to 2011. I'd just write it with pen, 2012, say, and then I would enter the names that I had handwritten on my computer sheet, and I would resort it alphabetically by their last name. So at the beginning of 2012, I have a fresh list of everybody that's in the building or in that home. And I think that's it for the resident reevaluation sheet. With Colago now, If a resident is overdue for their 3-month reassessment, Call-A-Go every time there's a service billed and that resident has not had their 3-month reevaluation, Call-A-Go will send a warning email out to the PT as well as to support office saying Mrs. Smith requires reassessment, and when you open the email it'll tell you the date that she had her last assessment with the PT. So it's just to help keep everybody on the ball so that we all meet our college regulations about seeing people every 3 months. So use the sheet to plan your months and to plan who you're supposed to see when, and if ever something happens and you don't see them, well, every time that resident is billed for a treatment and you haven't reassessed them, you'll be getting an email to remind you to do that reassessment. So in community and retirement homes, the doctors may not be coming into the home on a regular basis. In nursing homes, we don't need to do a special report to send to nurses or to doctors because we can actually document in their charts. It's not so easy in retirement homes and community homes, so there is, you don't have all the RIMDS stuff to do. What we do ask though, and this is a very good practice to get into, is after you've done your initial assessment with a resident, you take out the physiotherapy initial assessment report, and this is what it looks like. It's a very easy, it's a one-sided form. It's very easy to fill out. You just need to write the doctor's name, the resident's name, date of birth, address, health card number, the date you assessed them for their initial assessment. Based on today's assessment, the resident shows the need for the following. Check it off. You can write little details if you want. If you add information, it'll just look better for you and the doctor will be more impressed. Then you can just check off here what you're doing for the physio treatment plan and fill in the bottom. If you have any questions about the suggested treatment plan, please contact me. Print your phone number, your name, your signature, and the date that you complete the report. Fax this off to the doctor as soon as you can after your initial assessment. That way you're keeping in good communication with the doc. So they're signing the referral for you. You're going to do them a favor by sending them this for their chart. Later on, you're going to need to send them the 85th visit form to sign and get back. If you send them updates on their patients, our residents, every now and then, they'll be more apt to sign those forms back to you because they'll know you're keeping them in the loop of what's going on with their patient. So you can either, if the doctor actually comes to the retirement home, you can leave a copy of this for the doctor. If you're in a community home or a retirement home where the doctor does not come to visit on a regular basis, I would suggest faxing it off to their office. And again, similar to the initial assessment report that we just went through, this is the in-home physiotherapy progress report, and this is what it looks like. And pretty much it's the same information as on the initial assessment report. However, so the same information at the top. The top part here says, to date the resident has shown improvements in or maintained ROM, chest condition, pain control, strength, walking, balance, transfers, or other. What I do when I fill these out is because in some things the resident may have maintained their status and in other things they may have had improvements. So if they've had both, I'll, for example, circle improvements and then I'll circle balance and I'll circle strength. And if they've maintained range, I'll underline the word maintained, and then I'll underline the things that they've maintained, just to show the difference that they've had some improvements and some things maintained. You can write little comments here. If they have had improvements in range of motion, you may want to make a comment that pain-free shoulder abduction is now full or something like that. If it's about balance, I'll often on the right-hand side, I'll just say Tinetti score improved from 19 out of 28 to 24 out of 28, which is low risk of fall now, or something like that. I'll comment on their tug score, their unipedal stance score, whatever it may be. The next section here, the resident shows continued need for attention to the following. It's the same 6 categories. You can check off, you can add little comments, strength, especially leg strength, or especially shoulder abduction strength, or something like that. If it's balance, you may want to write especially unipedal stance with eyes closed or something.